The numbers are also driving a spike in the demand for testing for COVID-19.
And tonight at 5, our Rich Nye shows us how health departments are trying to respond.
Jessica Snellbaker brought an SUV full of kids to get tested for COVID-19 Wednesday afternoon.
They went to school this morning, and then my niece started having symptoms. But there's been like there was 8 kids total come out of school when we were leaving.
This mom is also waiting on test results for an older daughter who came home sick from school Monday.
It's like a domino effect. And so it was like, okay, we're done for 14 days at least.
The Marion County Public Health Department is operating one COVID testing site here in the parking lot of its headquarters. In the last 2 weeks, the number of tests have doubled, right along with back to school. About 85 daily COVID tests at this location, part of an average of over 27,000 across the state.
The demand for testing skyrocketed right about the same time. Many of our testing sites across the state were kind of decreasing the amount and hours that they were available to do testing, which we know has resulted in some prolonged waits and frustrations.
Many of the vehicles waiting in line for COVID tests are filled with school children.
Kids that are symptomatic, whose parents are concerned and want them tested. Kids who have been sent home because they had a headache or a stomach ache, and in order to get back into school, they need to be able to have a negative test. Kids that have been quarantined because of a close contact and they weren't masked, and so they've been sent home, and now they want to get tested to get back into school.
The state health department is calling back the National Guard for help and asking all vaccine sites to also offer testing.
We need you to do the right thing, and that's get vaccinated, and that will keep our kids in school. That will keep our businesses open.
The daily average of COVID tests in Indiana right now runs almost 3 times more than the daily vaccinations.